flesh, and I really did not feel much pain. This day represents a real milestone for us as South Africans, that finally the vaccines are here and they are being administered. And I was rather pleased that there were 5 people who were vaccinated before me, and they are health workers, and it was a joy to watch them to see whether anything had happened to them, and gladly nothing had happened to them. And it means that being vaccinated is a fairly straightforward process. And I'd like to invite South Africans to take this up so that we can all be safe, we can all be healthy. But I also want to thank the Minister for having worked so hard. Minister Mkhize spent sleepless nights making sure that the change from the earlier vaccines that we had acquired, which proved not to be so effective against the variant we have, happened so quickly and so smoothly. I can tell you that he spent sleepless nights, sending me text messages almost every hour. And it was a joy to finally get his text message that the plane has now left Brussels, and he showed me the photograph of the plane as it was being loaded, and every step of the way. So I'm really glad, and he's been so focused, he's been working so hard, and thank you, Minister. And MEC, Dr. Mbombo, would like to thank you too. I did say that our provinces are really ready for the vaccination process, and I was glad to see that they've trained people. There are many people who were trained here. They were earlier trained for the AstraZeneca vaccine, and they had to change very fast to start training people for the Johnson & Johnson vaccine. Now it does so that our health system is robust, it's agile, it's effective, and our health workers are able to get up to speed very, very quickly. And I saw a real army of our health workers, all knowledgeable about what we are now doing. Now this is really a milestone, as I said, for our country, and we are going to be rolling out this vaccine throughout the country. It's already started in a number of health centers, and I think it's going to be flawless. I think it's going to be done effectively, and as we get more and more of these vaccines, as the Minister brings them in, I think we will be able to vaccinate up to the 40 million South Africans that we should. So this is a new era for us, and an era that will mean that, yes, we restore the health of our nation, and we do so with our health system, or through our health system that is robust, that is gaining strength on an ongoing basis. And I'd like to say to all the doomsayers who've been, preaching that there's going to be total mayhem and disaster, I think let's all have hope and faith in our system, in our health workers, and let's give them an opportunity to do what they do best, because they know how these vaccination processes are going to unfold. As for us in government, we will continue to give them the support and the help and all the assistance that we are going to be able to give them. So I'd like to thank you all for being here, and I'd like to thank the staff for having treated me well as well, and I'm hoping that they will be able to treat every South African who will walk through these doors as well as they treated me. So you will make sure that it happens. Yes. Thank you very much, MEC. Thank you very much, Minister. Okay, thank you. Thank you. So I have to go to Parliament. I'll leave the Minister here, because at 2 o'clock I'm going to be listening to the reply to the State of the Nation address. So the Minister, who knows everything about all these things will answer all your questions. Thank you very much.
Thank you, Mr. President. Thank you for the support and the leadership. Thank you for being here. And really thank you for taking the jab. Thank you. We now wait for the questions. Thank you very much.
Thank you so much.
Who's going to help us coordinate?
I will coordinate, but I'm going to take all of. Thank you. Thank you. I'm just now coordinating the questions to the minister whilst the minister is here, and also even from the team, if need be, Professor Glenda Gray and also Professor Becker, who are part of the implementation study. They are also here. So, and also for our side, the coordinators for the whole of this, Dr. Karim and your team with Dr. Krish Valabji and also Ms. Juanita Arens, who are also the overall for the sites in regard to that space. So I see, and let's start this side. We'll start with Malvern, News 24, ENCA, 3, RT4, we take 5. Okay, take 4. Malvern?
Prime Minister Martin Charles from News 24. I just wanted to find out, how do you feel about the fact that this has been rolled out here in Khayelitsha, and also the fact that some organizations have raised questions about when refugees fit into this criteria, will they be able to also be part of the vaccine rollout? What is your response to that?
Let's do all of that, okay? Aisha?
Last night with the Johnson & Johnson vaccine, what was the first thing that went through your mind and how did you feel?
Yep.
Afternoon, Minister. It's Christian Du Plessis here from Netwerk 23. Minister, I would firstly like to ask you whether you yourself have also been vaccinated, and secondly, COVAX is finalizing its arrangements for shipment. Have you managed to convince them not to send another vaccine other than the AstraZeneca vaccine? And then lastly, are we still considering giving away the 1 million doses of the AstraZeneca vaccine to the African Union? Or how sure can there be that there will be an alternative for people to be vaccinated by another vaccine? Thank you.
The last one, newsroom.
Atim China from Newsroom Africa. I have got not a few questions, but just 2 questions. One is around who will be vaccinated, and as far as the cabinet is concerned, have you been vaccinated? The president has been vaccinated. We understand that this first phase is for healthcare workers, but will government leaders, particularly in the cabinet, get vaccinated, and when will they get vaccinated? The second question then is, what is the situation in other provinces? The Western Cape, we've seen the president getting vaccinated. Is the same kind of treatment been given in other provinces where they're ensuring that healthcare workers are getting vaccinated as well?
Yeah. Thank you. Minister?
Thank you very much.
Switch that one off.
Just switch to that one off. There you go.
Yeah.
Thank you very much for the questions. Firstly, thank you for your interest in covering a very important milestone in our fight against COVID-19. I want to start by thanking President Cyril Ramaphosa for his leadership and for his support, and I want to thank him for breaking his schedule and come over to take the first vaccination, and therefore making it clear to all South Africans that we are determined to save our health workers and also making it clear that we're all determined to make sure that South Africans are protected from this pandemic. Having been here already, must give hope and encouragement to all our people that at least we now have a possibility of defeating COVID-19. I want to thank the team. On my right here, we have professors led by Professor Glenda Gray from MRC, who have done a lot of work with us as a ministry. I also want to thank the Director General, Dr. Mkhize, from the National Department of Health, for all the work that has been done. It's a whole team effort behind the scenes. They have not slept a wink. They have worked so hard to make sure that this works. I think all of us are aware that we were put in a situation where we were to deal with Plan B, which meant that we were to change from what we originally planned when we got surprising results, and we thought we needed to create a bit of space so that we are able to check what's happening so far as the one Caulfield vaccine was concerned. So I want to say thank you, MRC, Professor Gray, and the whole team, and as well as Dr. Mkhize for all the work. I know they didn't sleep because I used to wake up in the middle of the night and call them and ask them what's happening, and they were actually always up there alert. And we've had lots of meetings with the manufacturers. Even they, we want to thank them because we actually got them out of their schedule. We actually pushed quite hard to say we need this, and they needed to move. They went beyond what is usual to actually make sure that we get the provision from South Africa. So I want to thank in particular the chief investigating chief scientist, Professor Paul Stoffels, Dr. Paul Stoffels, and his entire team for all the work that they've done. And I'm sure they would sit there and watch to see South Africa beginning to start the very, very important work of vaccinating our people. Having said so, I want to thank our health workers. Our health workers have persevered and endured anxiety, panic, the risk, the threat of getting the infection and infecting their families. And what to say to them, we did say at the beginning that they are our frontline warriors. We need them protected. We need them encouraged. We need to make sure that they are the ones who are safe so that our country can be safe. Our country has been saved because of their dedication and our commitment and our hard work. And today we're saying we are now responding, and we're saying we're here to help to make sure that the health workers are protected. So when we were going through all of this, of course, one was filled with a mixture of emotions. On the one side, it was a lot of excitement that this program was at last going to take off. And of course, it was quite an exciting moment, probably emotional moment when we get the message that the flight has landed. And as we have heard Professor Gray, they have been giving us, every so many miles of flight, they would actually say this is where it is, this is where it is. So we tracked it from the first time it left the African soil, went to Brussels and back, and we wanted to know what was happening. So there was a lot of excitement from that point of view. And also I want to say that there was a sense of pride that we had our team. Everyone out there has been very helpful, wanting to assist us, and they've actually risen to the occasion to do everything that needed to be done to save the people of South Africa. And that, for me, filled me with a lot of pride. But at the same time, it was also a sense of pride that our own people, our health workers, will at long last be able to say, yes, I've got some degree of protection as I face this formidable pandemic ahead of us. But at the same time, we also had a sense of humility of how our people have actually waited for this moment to arrive, not giving up, persevering, facing on, dealing with the wave after wave of COVID-19, like soldiers in the war who would stand up and face the enemy, fight on, even though they lose their comrades, their colleagues, and then in the process, they would still wake up and continue. And for me to serve with such a formidable army of health workers, it has filled us with a lot of humility. And we want to say thank you to them all. And we also want to say to the members of our community that have lost their loved ones, their friends, their relatives, their comrades, their workmates, that to all of them, they have our sympathies. We owe a great debt of sympathy to them for the carnage that we have all gone through, the decimation that we have seen in terms of the numbers of people, particularly in the second wave, because it has been, completely unimaginable that you could lose so many people within such a short space of time, and that you could lose them in a way that the second wave had actually demonstrated a huge amount of unpredictability. I went and spoke to a number of doctors, and some of them in intensive care units, and I said to them, what can we do? They said, we are specialists in this field. We have done this, we enjoy it, we have saved so many lives, but this one wave has been problematic. It's unpredictable. We do everything that we know needs to be done, and we suddenly find that the presentation of the illness is very different, and therefore we don't quite know what's going to happen. So I want to therefore indicate that it's been a very, very grueling fight that our health workers have gone through. Having said so, then I want to then say we are here where we are now. This is the beginning of a new era, as the President has indicated. We have today distributed throughout the whole country 80,000 doses of our vaccine, and this 80,000 is spread to over 32 sites throughout the country, and those sites are largely the sites which are Medical Research Council sites combined with those of the Health Department who are managing the rest of the program. We're expecting between now and the end of about 4 weeks, we should at least be able to reach about 500,000 doses that we should be able to receive. And in that process, they will be coming in waves, and week by week, we should be getting additional doses. And out of that process, we will actually be vaccinating at the same time running an implementation study. That study is basically to say, once people have been given the vaccine, we are watching how there might be any breakthrough infections, particularly as people are working in a high infection area. And for that reason, we're going to continue the observations amongst all of those who will be vaccinated. We are anticipating also that there will be additional doses that will come from Pfizer, and within the next month there will be a number of those that will be coming through. Initially, we actually are expecting about 500,000 of those doses. So when they come, we'll simply continue with the vaccination, which in fact means that we will have vaccinated the first 500,000 if we are able to deal with that, and then of course the next 500,000, all of those will be the first doses. We have learned from research that you can do one dose, and then between 3 and 4 weeks, or up to even 6 weeks, we're still safe to go. But we've actually learned from the UK that we can actually wait for 3 months, which means we can actually vaccinate a large number of people within the period, so that everyone gets the initial protection, and thereafter will then come with the second doses. We are expecting that by June we have a commitment from Pfizer of about 7 million doses that should be coming here. And I must indicate that this is all because we've actually asked for consideration for South Africa being an epicenter in the continent, and the fact that with the raging second wave that we've gone through, we then asked to change all the plans that they had. So we are there to renegotiate all of them. We will announce all of those dosages or those vaccine numbers once we have finalized all the agreements, and they are very close to being concluded now. And so we will give you a sense. But all I can tell you is that as we sit now, we've actually got enough doses in the discussion, in the pipeline, to cover all South Africans, as based on the number of 40 million that we had spoken about. We will only give you the details once all of that has been done. I can just say to you, we are not at all anxious that we might run into problem with our vaccine program. So of course the questions that have now been raised, we have responded to the aspect of how we've been all feeling. I want to also say thank you to all the provinces. They have all prepared